Welcome to What to Expect During Your Postnatal Stay on Rothschild Ward. This video focuses on Rothschild Ward and will cover the ward environment, the care you can expect for you and your baby, visiting rules, and the process of being discharged home. Who stays on the postnatal ward? Some families are discharged home from birth center or labor ward 6 hours or so after birth. However, this is usually following a vaginal birth with no complications, where there are no medical concerns for mother or baby, and if additional feeding support is not needed. For this reason, the majority of families spend at least one night on the ward for monitoring, blood test, feeding support, etc. If you have a cesarean section, the average length of stay is 1 to 2 days. The postnatal ward has 4 bays. Each bay has 4 to 5 beds and an ensuite. Throughout your stay, your baby stays at your bedside in their own cot. The ward also has 3 side rooms. Priority for side rooms is given to patients who are unable to share a bay, for example, those with COVID or flu. If side rooms are available, where possible, we prioritize families who will be on the ward for a particularly lengthy stay. If we are able to, any side rooms which are still available are offered to those wanted to pay for the extra privacy a side room affords. Rooms are available on a first-come, first-served basis and cannot be booked in advance. Cost per night ranges from £90 for rooms without a private bathroom to £195 for the ones that have a private bathroom. At your bedside, you will find a cot for baby, a reclining chair for partners and visitors, and a table. In the case of an emergency, professionals will need to be able to access all sides of the bed and cot. As you can see, there is not a huge amount of space, so we ask that you pack carefully. For advice on what to pack for the hospital, we recommend the checklist by Tommy's. This is a map of Rothschild Ward, with the postnatal section being on the left side of the map. All bathrooms and toilets on the ward are for patient use only. This is to ensure bathrooms are available to new mothers at all times. Visitors are asked to use the toilets located in the corridor just outside the ward. A member of the staff will be happy to pass you into and out of the ward. Please note there are no showering facilities for visitors. Breakfast is served at 8 a.m. The breakfast trolley can be located by the main entrances to the ward. Please help yourself. If you are unable to mobilize, your partner or a staff member can help. Hosts from the catering team will bring your lunch and dinner to your bedside. Lunch is usually the larger meal, with dinner being a sandwich. If you require a hot meal outside of meal times, we can order one for you. We do not provide meals for partners. Please self-cater, go to the restaurant, W.H. Smith, Asda, Costa, vending machine, etc. We have a hot drinks machine located near the ward entrance. You and your visitors are welcome to help yourselves 24/7. Please note, we do not have a patient fridge or microwave, so please bear this in mind if you bring in extra food or drink. One birth partner or companion is welcome to stay with you 24/7. Between 3 o'clock in the afternoon and 7 o'clock in the evening, you may have a maximum of 2 adults with you and your other children. For infection purposes, no other children are allowed, only your own. On rare occasions, there may be patients who do not feel comfortable with men in their bay overnight. To respect their preferences, we may offer to transfer you to a different bay to facilitate your partner staying with you. However, if this cannot be achieved, we would ask your partner to go home to sleep. Due to limited space, we cannot provide bed showers for partners wishing to stay overnight. If you are overtired or have health issues, we recommend going home to sleep. Remember, you need to be safe to drive your partner and baby home. Parking overnight is not free. Normal parking charges apply. Our visiting rules are displayed on the ward and can be seen on our website. In terms of safety on the ward, the baby must stay on the ward and the bed space at all times. The trust adheres to a no smoking policy, and visitors will not be able to leave the unit to smoke, vape overnight. It is advised that you do not stay if you cannot go without smoking, vaping overnight. For infection purposes, visitors must not sleep in or on beds. Unless the visitor needs the toilet, visitors must remain at the bedside between 9 p.m. and 9 a.m. Men wandering the ward can make women feel uncomfortable or threatened. Visitors must be appropriately dressed at all times. Pyjamas, just underwear are not permitted. Shoes must be worn at all times. Furniture should not be moved. It has been let out to ensure staff can access mothers and babies safely and promptly when required. Sharing environment. Visitors must use the visitors' toilet on the main corridor. This ensures the ensuite remains available for patients at all times. Keep noise levels to a minimum between 9 p.m. and 9 a.m. Loud conversations and phone calls videos on loudspeaker are strictly prohibited. Visitors who compromise the safety or well-being of our patients or staff will be asked to leave or will be removed. To ensure the mothers and babies on the ward are kept safe, we operate a strict door policy. Should you wish to enter or leave the ward, you will need to notify a member of staff. To support staff in checking the identity of visitors, we ask that you do not hold the door open for people, tailgate, or allow tailgating. Tailgating is when you following someone authorized to access the ward while the door is open. You will come across a variety of healthcare professionals and support staff during your stay. If you would prefer not to have students involved in your care, please inform a member of staff. Please let us know if you need anything, including pad changes, new bedding, pain relief. Some women require a catheter during labor or the birth, which remains in until you are able to mobilize to the toilet. Once this is removed, we will monitor your urine output to ensure your bladder is functioning normally. The care you can expect for your baby. Some babies require regular observations or blood sugar monitoring. All babies will be offered routine screening, including the newborn examination and hearing screening. Each family's journey from hospital to home is different. Some families are in hospital for 6 hours, some are in hospital for a week. It depends on type of birth, how much blood was lost, whether you or baby need intravenous antibiotics, etc. There is nothing like your own bed, and we appreciate that you will want to bring your baby home and get settled as soon as possible. However, we recommend that you wait until you and your baby have had all the necessary care and checks before leaving. There are quite a few checks on you and your baby to get you ready for home. Whether you require a catheter or not, we ensure your bladder is functioning normally post-birth by measuring your first urine output. In addition to this, some women will require blood tests, particularly if they had a heavy blood loss at birth or there are concerns around the blood pressure or infection. You and your baby may also need to be reviewed by our doctors to be signed off as fit for discharge. They may prescribe you drugs to go home with, and this can take a while to arrive from pharmacy. All babies are offered a thorough head-to-toe examination before they go home, and a hearing test too. We also like to know that babies feeding effectively or have a robust feeding plan in place before you go home. Finally, the midwife or nurse will complete your discharge paperwork. This ensures that the GP and health visitors have all the information they need to support you in the postnatal period. On the day of your discharge, you will likely leave the ward around 4 p.m. In some cases, families will be discharged much earlier than this, sometimes later, depending on any outstanding care and checks you and your baby require. We appreciate your patience during this wait. We appreciate this is a lot of information to absorb in this video. You will be advised on your expected length of stay and the care you can expect by your caregiver. If you are ever unsure on what the next steps is, please ask. If you would like more postnatal information, please see our videos accessible via the Bucks Healthcare website. In terms of key tips, please press your call bell for support day and night. Manage your expectations on the day of discharge. Ask for a realistic home time to avoid disappointment. Try and step outside every once in a while. Bring your home comforts, eye masks, your own pillow, food, whatever it is. Be social, get to know the other families on the ward. This is your chance to ask questions. Ask away about your labor and birth, feeding, or what's normal during recovery. Before you go home, you should be offered the opportunity to ask any questions you have about the birth. This may be with the doctor reviewing you or your midwife. We do not want you going home unsure about anything that happened. So if you are not offered a quick chat, please know that you can ask.